Shortwave diathermy. Shortwave diathermy uses oscillating high-frequency, non-ionizing electromagnetic energy to produce deep heat within the tissues. The energy created by a diathermy unit is similar to the broadcast radio waves. Diathermy does not affect motor or sensory nerves, as the electromagnetic energy that is produced does not have the wavelength duration to activate these structures. The word diathermy means through heat, from the two root words dia and therm. Diathermy uses high-frequency electromagnetic waves to heat up deep tissues. Heat is produced by the resistance of the tissues. There are two main classifications of diathermy. First, a medical application, which is for therapeutic purposes. And the second is surgical, which is utilized for cauterizing or burning tissue. The three types of medical or therapeutic diathermy include long-wave diathermy, which is no longer used, short-wave diathermy, which is commonly used in therapeutic treatments, and microwave diathermy. The focus of our lecture today will be on short-wave diathermy. Short-wave diathermy units are expensive, ranging from $3,000 to $25,000. And unfortunately, many insurance claim forms do not include billing codes for diathermy treatments clinically. Diathermy treatments are commonly used in other countries, such as the United Kingdom. Diathermy is used infrequently in the United States for several reasons. Diathermy units are very expensive. Diathermy usage has been plagued with infamous folklore and misinformation about treatments, which is mostly due to outdated research. However, diathermy has recently started to gain some popularity within the United States as a therapeutic treatment device. The Federal Communication Commission, or FCC, has reserved the frequencies of 13.56, 27.12, and 40.68 MHz for medical usage, with the 27.12 MHz frequency being the most commonly used. A 27.12 MHz treatment has a wavelength of 11 meters. Shortwave diathermy forms a magnetic field in the tissue. But since the wavelength is so very long, approximately 11 meters, it will not depolarize motor or sensory nerves like electrical stimulation. Ultrasound and shortwave diathermy are both utilized to treat deep tissues with thermotherapy. When comparing shortwave diathermy to ultrasound, the shortwave diathermy does not get reflected by bone. In addition, shortwave diathermy does not have a beam non-uniformity ratio like ultrasound. Therefore, it is less likely to create hot spots. The effect of shortwave diathermy lasts 2 to 3 times longer than treatments with ultrasounds do. There is no medium required with shortwave diathermy. Shortwave diathermy can be applied over some clothing. Shortwave diathermy, once set up by the clinician, can be administered to the patient without the clinician's presence. Ultrasound requires that a clinician be present for the entire length of the treatment. In addition, shortwave diathermy can affect a significantly greater volume of tissue than ultrasound. The treatment area for ultrasound is 2 to 3 times the size of the effective radiating area of the ultrasound head. In contrast, shortwave diathermy can treat a much larger treatment area. So when the target is a large area, such as an individual's back, their hamstrings, quadriceps, or other large muscle areas, the diathermy treatment might be more effective than multiple small ultrasound treatments to treat the same area. There are two types of shortwave diathermy generators. The first is an inductive field generator, and the second is a capacitive field generator. The inductive field generator uses a drum or a cable to administer the treatment. The capacitive field generator uses plates or pads to administer the treatment. The type and depth of tissues affected and the subsequent increase in tissue temperature varies between the two types of shortwave diathermy application. Let's start with induction field shortwave diathermy. Induction field diathermy is also sometimes called magnetic field diathermy. Induction field diathermy is a high-frequency alternating current that flows through a coil that creates an electromagnetic field which radiates away from the cable. The induction field method places the patient in the electromagnetic field produced by the equipment. The patient's tissues are in the electromagnetic field but are not an actual part of the circuit. Electromagnetic fields arise perpendicular from the cable, causing ions to oscillate and creating an eddy current. The density of eddy currents is proportional to the tissue's electrical conductivity. The friction caused by the movement of the ions produces heat. Muscular tissue is selectively heated over adipose tissue. The amount of heat produced depends upon the strength of the electromagnetic field and the distance between the tissues and the source. As the distance between the tissues and the electromagnetic field increase, the strength of the field decreases by the square of the distance via the inverse square law. Induction field shortwave diathermy is delivered using either cables or drums. At the bottom are examples of A, a plastic drum housing, and B, the plastic drum housing removed to expose the coil that produces the electromagnetic field. The resulting electromagnetic field will produce a circular flow of energy, similar to that of a coil. This is similar to how a microwave oven heats up food. Induction generators produce the greatest amount of heat within the muscle layer directly beneath the coil. Inductive shortwave diathermy is non-tissue type specific and is considered to be safer than capacitive. The most common method for induction field diathermy includes the use of a drum method. The size of the drum is approximately 200 square centimeters. The cable is coiled within a plastic drum that is placed over target tissues. Inductive drums have a built-in space plate to keep the source of the energy away from the patient's skin, which decreases the risk of burns. The drum is placed 1/2 inch to 1 inch above a towel that is placed over the target tissue. A secondary method for induction field diathermy is the cable method. The cable method involves wrapping a conductive cable around an extremity or coiling it and placing the cable on the patient, using terry cloth toweling to buffer the cable from the patient's skin. Because of the complexities of the setup and the potential to cause burns, if done improperly, the cable method is infrequently used. Regear's Rebound is a pain management product that is a compact, portable, and simple-to-use heat therapy system, generating soothing, deep tissue heating through diathermy. Treatment is delivered via comfortable, anatomically specific therapeutic garments that can cover small and large body areas. The Rebound Therapy Heating System weighs just under 4 pounds and is highly portable. Rebound is unique and has a frequency of 13.56 megahertz rather than the typical 27.12 megahertz that is commonly used with shortwave diathermy. The 13.56 megahertz allows for deeper penetration into tissues and allows the product to be lightweight and compact. Rebound can be used to treat virtually any condition where thermotherapy is indicated, including chronic pain, muscle spasms, and joint contractures. Radiofrequency diathermy is a well-validated and accepted thermotherapy treatment modality. The Rebound provides circumferential heating of large and small surface areas to relieve pain and accelerate the healing process associated with injury, aging, and disease. Rebound is FDA cleared and eligible for insurance reimbursement. Rebound diathermy utilizes technology initially developed by the U.S. Navy to warm Navy SEAL members and deep-sea divers following their missions. Rebound is designed to apply shortwave diathermy through a unique longitudinal coil induction cable covered by fabric. The induction cable inside the rebound therapy garment creates an oscillating electromagnetic field. Another product on the market is called Vivi. This is the world's first consumer pain management product to use deep heating and healing powers of diathermy. Vivi relieves pain, eases muscle tension, improves joint mobility, and speeds healing. Vivi is currently an investigational device only and is not yet available for sale in the United States. Keep your eyes and ears open. While Vivi is not available yet, it may be available soon. This could be the future of diathermy treatments and allow for patients to treat at home, much like TENS units allow patients to use electrical therapy to self-treat. A capacitative field, also referred to as a condenser field, uses the patient's tissues in the actual electrical circuit. When alternating current is applied to the circuit, the plates will always have an opposite electrical charge, creating a strong electrical force between them. The flow of electrical energy passes through the tissues as a series of circuits, which act as an electrical resistor and produces frictional heating. The tissue resistance to the flow of energy produces heating. Tissues that present the most electrical resistance, such as adipose tissue, produce the greatest amount of heat. Capacitative generators affect tissue under each plate and selectively heat adipose tissue and bone. Heating with capacitative shortwave diathermy is highly dependent upon the water content and is not recommended for patients who have thick adipose tissue layers. Heat is produced by the dipole effect. Dipole molecules are molecules having no net electrical charge, but having oppositely charged ends that are randomly arranged within the tissue. When exposed to intense electrical fields produced by diathermy, the molecules rotate in the opposite direction of their charge. Positively charged molecules move towards the negative pole, and negatively charged molecules move towards the positive pole. The word dipole means that there are a pair of equal and opposite charges separated by a distance. The number of times the molecules rotate each second is based upon the frequency of the current. The high-frequency current, such as used in shortwave diathermy, produces rotation that creates kinetic energy, which is released as heat within the tissue. The current flows along the path of its least resistance, concentrating heat in the superficial tissues. The capacitative method is not recommended for patients who have large layers of adipose tissue. Capacitative shortwave diathermy is administered using either the plate method or pad electrodes. The plate method is similar to the induction drum in that metallic coils or plates shielded by plastic are applied around target tissue. An electrical charge builds on each plate until it discharges to the opposite one based upon the unit's output frequency. A unit of 27.12 MHz would repeat this cycle 27,120,000 times per second. The plates will need to be spaced equal distances from the body on each side, otherwise they may result in uneven heating. The plates should be stationed approximately 3 centimeters away from the body on each side, and the patient should be still during the entire treatment. In the pad method, the pads are placed in contact with the skin. To provide uniform heating, pad electrodes require even more contact pressure and a uniform distance from the skin, otherwise burns may occur. The pads are placed on the skin on either side of the target tissue. To prevent the density of energy from becoming too great, These electrodes must be spaced at least their diameter apart. Most of the heat is produced near the source of the shortwave diathermy unit and just below the adipose tissue or muscle interface. Increased adipose tissue thickness will reduce the rate and the magnitude of intramuscular heating. Capacitative is not recommended for patients who have large layers of adipose tissue. The amount of heat produced depends upon the strength of the electromagnetic field and the distance between the tissues and the source. As the distance between the source of the electromagnetic field and the tissues increase, the strength of the field decreases by the square of the distance. The inductive shortwave diathermy ends up treating superficial muscle. Capacitative shortwave diathermy treats mostly adipose tissue and bone. In comparison, ultrasound treats more collagen-rich structures like tendons, ligaments, joint capsules, scar tissue, and fascia. The inverse square law. This law states the intensity of the energy striking the tissue is inversely proportional to the square of the distance between the source of the energy and the tissue. The inverse square law is calculated by taking the distance squared and dividing it by 1, which will equal the overall intensity. The formula is I, intensity, equals 1 divided by the distance squared. The cosine law states that as an angle deviates away from 90 degrees, the effective energy is reduced by the multiple of the cosine of the angle. This is calculated as the energy multiplied by the cosine of the angle, which equals the effective energy. A deviation of plus or minus 10 degrees is considered within acceptable limits for therapeutic treatments. In other words, electromagnetic energy is most efficiently transmitted to the tissues when it strikes the body at a right angle, or a 90-degree angle. When the treatment angle is not perpendicular, the resulting energy becomes more and more reflected with the greater the treatment angle. Treatments at 90 degrees are 100% effective. A treatment at a 60-degree angle would be 86% effective, and a treatment at a 30-degree angle would only be 50% effective. With the use of shortwave diathermy, there is a slight risk of fire hazard. This is mostly related to clothing choices of a patient, and then the application of diathermy. Although the risk of fire is a relatively low incidence, it is something that needs to be considered and discussed within the application protocol. Clothing options that are best for diathermy application are materials made of cotton. Any plastics, fabrics, or certain synthetics that are made from nylon, polyvinyl chloride, or polyethylene terephthalate pose a risk for fire. Use common sense with your patients and the application of diathermy. Make sure to properly position the patient and be aware of your surroundings. This can all help to prevent fire risk. Keep all cables at least several inches away from other objects in the clinical setting as well to help reduce the risk. Shortwave diathermy can be delivered in either continuous or pulsed forms. The idea of continuous and pulsed settings are very similar in theory to ultrasound. The biggest difference is that the heating is more aggressive. Continuous shortwave diathermy increases tissue temperature for subcutaneous tissue, and it is generally used for chronic injuries. The continuous treatment uses higher intensities and causes a rapid temperature increase. Pulsed shortwave diathermy produces both thermal and non-thermal effects. We use a lower intensity and the machine has a distinct on and off time. This pulsed shortwave diathermy protocol is commonly used with subacute and acute injuries. Generally, in pulsed diathermy, the off time is considerably longer than the on time. Pulsed shortwave diathermy seems to be the best of both worlds at offering both thermal and and non-thermal effects. Pulse width or pulse duration is the on time required for each pulse to complete its cycle. The interval between the pulses is the off time. A wider pulse increases the energy and increases the thermal effects. The pulse width is commonly set at 20 to 400 microseconds. The pulse frequency is higher. This is the number of pulses delivered per second, or PPS in hertz. The greater the number of pulses per second, or PPS, the more energy produced. The higher the pulses per second per hertz equals increased energy and increased thermal effects. A typical pulse frequency should be around 10 to 800 hertz. Power or intensity. This is the function of both the pulse width and the pulse frequency. Shortwave diathermy with long pulse width and a high pulse frequency generates more power than a short pulse width and low pulse frequency. This is measured in watts, or the total energy applied to tissue. The higher the watts equals increased energy and increased thermal effects. Here are some different examples of different on-time and off-time pulses. The top one is continuous. We can see that there's no duty cycle or no off time. The second one is a pulse cycle at 50%. This means that the machine is on half of the time. The bottom image is also a pulsed 50%. The biggest difference between it and the middle one is the pulse frequency. Shortwave diathermy treatments last for approximately 20 to 30 minutes. We should schedule no more than one treatment every 2 hours for the patient. The treatments may be repeated as needed for up to 2 weeks. When a higher temperature is used, it is recommended to decrease the treatment time to 15 minutes. Always use a dry terry cloth or towel to cover the patient. This towel or terry cloth has several functions. First, it provides the proper spacing, but it also absorbs any perspiration on the skin. Any water is going to add to the intensity of the heat, so if someone sweats profusely, the towel or terry cloth may need to be changed during the treatment to stay dry. The towel or terry cloth should always be dry during the treatment. And remember, we cannot use shortwave diathermy in conjunction with any other devices, such as e-stim or a moist hot pack. The physiological effects related to the application of shortwave diathermy include both thermal and non-thermal changes. The effects associated with thermal treatments include deep heating. Shortwave diathermy can heat intramuscular temperatures to a level of 4 or 5 degrees Celsius. We can see an increase in blood flow, extensibility, cellular metabolism, and there is an associated muscular relaxation. The effects associated with non-thermal treatments include improved tissue healing, including open wound healing and edema reduction. The indications and contraindications for the use of shortwave diathermy. The indications include acute, subacute, and chronic pain, subacute and chronic inflammation, range of motion restrictions, muscle spasm, edema reduction, fracture healing, hematoma and contusion resolution, sinusitis, and venous stasis ulcers. The contraindications for shortwave diathermy, in addition to the general contraindications for heat, include metals, plastics, and cements, impaired circulation or sensation, blood clots, fever, cancer, pacemaker, sensitive areas, pregnancy or menstruation, acute injury if you're using it thermally, or the use of diathermy over large regenerating nerves, also a thermal application. There are many precautions for the use of shortwave diathermy. Some of the most important precautions include removing contact lenses when applying shortwave diathermy around the head, face, or eyes. Individuals who are pregnant, may be pregnant, or who have implanted electronic devices should not be permitted within 50 feet of the unit. To avoid overexposure, a distance of 3 feet from the source of energy should be maintained to ensure the operator's safety. The skin should be covered by at least 0.5 inches of toweling, and do not allow perspiration to collect. The biggest precaution with the use of shortwave diathermy is to make sure that there is no metal within the electromagnetic field. There's a lot of metal objects on people, so some of the most common ones to look out for are jewelry, body piercings, watches, belt buckles, zippers, metal underwire bras, hearing aids, orthodontic braces, dental fillings, artificial joints, and internal or external fixation devices. Pulsed shortwave diathermy may be used over metal implants that are not circular in shape. It is best to consult with the user's manual to make sure that you are comfortable with their guidelines prior to treatment. This is a table that suggests the dosage parameters that are recommended for use with pulsed shortwave diathermy treatments. Please consult with this table for dosage, temperature sensations, and indications as well as setting parameters for different treatments. These treatments include non-thermal, mild warmth, moderate warmth, and vigorous heating. This table compares thermal ultrasound to shortwave diathermy. Ultrasound uses acoustical energy, while shortwave diathermy uses electromagnetic energy. Ultrasound heats collagen-rich tissue such as tendons, ligaments, fascia, and scar tissue, while shortwave diathermy heats adipose tissue and skin via the capacitive method, and muscle and blood vessels via the inductive method. The volume of tissue is nearly 10 times larger in shortwave diathermy than ultrasound for our treatment area, with 200 square centimeters compared to 20 square centimeters respectively. The temperature increase seen with ultrasound is less than that of shortwave diathermy. For a 1 megahertz ultrasound treatment, more than 6.3 degrees Fahrenheit temperature increase is available, and in a 3 megahertz ultrasound treatment, more than 14.9 degrees Fahrenheit temperature increase is available. With shortwave diathermy in the capacitive method, greater than 7 degrees Fahrenheit temperature increases are available, which are targeted to treat fat. And with the inductive method, more than 18 degrees Fahrenheit temperature increase are available, which can help treat muscles. One of the biggest differences between the two units is the amount of heat retention. For ultrasound, we have a very short window available to retain the heat and treat tissues. We have approximately 3 minutes after the treatment to treat our patient with the effects of ultrasound. With the use of shortwave diathermy, the heat retention window is tripled to 9 minutes. This gives the clinician more time to work on tissue extensibility exercises, joint mobilization, and stretching with the patient, and may result in greater increases in tissue extensibility.